Sanjana is done it. Okay. Thanks, Sanjana ji. Okay, so before we start the session, a quick introduction of myself and our group. So you may be knowing my name is Ganesh, and we have a group of volunteers who are leading a initiative of environmental and health. So there are a lot of initiatives that we are planning, and they're all exciting. They're all very passionate. All these volunteers are very passionate about this. Can everybody please go on a mute? Those who are not speaking. Okay, so so what I was saying is they were all passionate volunteers who are having a various initiatives that will be getting rolled out very soon for our premises. And the good part of, I think, our Oberoi Mulund premises, though many of us have now still gotten there, we are all become so very tightly knitted neighbors. So that's a very good bond that all of us are sharing. Having said that, let me introduce both Dr. Sanjana ji and Dr. Anita ji. So Dr. Anita ji is our speaker for today's session, and Dr. Sanjana will be moderating the session. We already shared the introduction earlier, but just to re-stress, Dr. Anita ji is a consultant in internal medicine. She's an MD and has an experience of 26 years. She specializes in infectious disease and is associated with Fortis Hospital, Mulund, as a director, medicine and infectious disease. So thanks, Anita ji, for joining in.
Thank you for the invite. Thank you.
Yeah, thank you. And thanks, Sanjana ji, also for joining as a moderator. And let me also thank Dr. Satish Nair. I'm not sure whether he has joined or not, but he has been very instrumental in getting this plan, at least the first session, contacting to Dr. Anita ji and kind of getting this through. Okay. Having said that, we are almost just 1 minute away to start the session. So let me start the poll. So there's an initial poll that we are launching to ensure that all of us are awake, because many of us are joining the online calls. Okay, so I think all of you can see the poll, right? Go ahead and give your answers. We'll keep it on for a minute. All of you can see it, right? Okay, there's a good response coming. Okay, we'll keep it open for a 30 seconds more. I think most of us will be responding by that time. Almost there. So 75% of them have responded, 15 out of 21. Maybe another 15 seconds and then we'll close the poll and then I will publish the result. Okay. So 17 of us have responded and all of you can see the result, Dr. Sanjana ji and everyone.
We need to stop sharing and then probably, yeah, I can see the result.
And everyone else?
Yeah, I think results are seen. Yeah.
Results are seen, right? Okay, so
Yeah.
good. So I think thanks to nowadays the social media and everyone, I think curiosity has become our next nature, and that is being shown also in our poll. Many of us are curious of how this session is going to be, content wise, technology wise, engagement wise. So I think we are all excited and curious about it. Rest of it is all medicine and medical domain, so I should keep my mouth shut and let me give the baton to Dr. Anita ji and Sanjana ji to take this ahead. So over to you.
Yeah, thank you. So I do see good questions that's come up. First one is, what do you feel? When can be dengue cured at home? So most of them have answered that, especially at early stages, it can be easily cured at home. The next question was, what do you think? Is dengue always a life-threatening disease? And 11 out of 17 people have answered depending upon the duration and condition of the infection. The last question was, according to you, what will be the approximate percentage contribution of Mumbai in overall dengue cases in Maharashtra state in 2023? And maximum people feel it should be around 25 to 50%. I think I should let the experts speak about all these things. Over to you, ma'am.
Yeah, thank you so much. A very good evening to everyone around there. Hi, this is Anita. If you are able to see my screen, then just let me know.
Yes, we can.
What's the
क्या
background?
गेस्ट थे घर पे तो इसके लिए पहले बात नहीं कर पाया.
Okay, so the topic which we mutually decided on was about dengue fever. That's basically because we have been seeing a spate of dengue infections in the city and in our township of Mulund quite recently in the past 2 months. So when we think in terms of monsoon, this is what we look forward to. We look forward to beautiful weather. We look forward to beautiful sights and scenic areas. We look forward to our pakoda and chai. We look forward to our charts. But unfortunately for us in the medical field, we also look out for this kind of a scenario. This is one of our premier institutes in the city where I work as well, which is one of the teaching hospitals. And this is the kind of a scenario that we have been seeing day in and day out since the last 25, 26 years. There's no respite. Time the monsoon begins in the month of June, till the time it's October, November, we have this spate of illnesses that we tend to see. One of the major contributors to this is also dengue. So this is from the recent articles that I had picked up from the paper, the e-paper rather. So you have dengue cases surge across India amid the monsoon revival. So all the cities, major cities have been inundated with these patients. Mumbai sees a rise in malaria and dengue cases. This is as of 19 September 2023. We recorded in this month more than 700 dengue and malaria cases in the city. This is the kind of graphic representation of the major illnesses that we really have in the city, which is leptospirosis, dengue, gastroenteritis, hepatitis, chikungunya, and H1N1. If you look at the numbers have been steadily worse this year as compared to the previous years. So there was a reason that the previous years we didn't have as many number of cases as well. That's basically because of COVID and the lockdown. The amount of construction activity, the urbanization, which was really very rapid till 2019, actually took a setback for the next couple of years. And that's the reason we didn't have a spike. But again, since everything has come back to normal and we have also gone back to our usual habits, we have seen an increase in the number of cases of both dengue, leptospirosis, and hepatitis as well this particular year. Now, what is dengue? It's a viral infection. It's a mosquito-borne infection. So you have different breeds of mosquito which are there. And this particular breed of mosquito which causes dengue is called as Aedes aegypti. It's a disease of the tropics and the subtropics, basically because our climate here becomes completely conducive for these mosquitoes to start breeding. It used to be called as a breakbone fever because the amount of aches and pains that you get because of dengue was bad enough to be termed as one. And it is from the same family of virus from which you have the other two conditions which also are equally debilitating, which is called as chikungunya and Zika.
Okay.
What are the major risk factors for dengue? The major risk factor is urbanization. So it's not to say that in rural areas you don't have dengue, but in rural areas you don't have as many areas where you would have a lot of population density. You do not have the major kind of a water storage practice that we have within the city. We also know that the houses are far and in between in the rural areas. So these are the reasons why we don't really see much of dengue there, though it still is prevalent. But even urbanized areas like ours, we generally tend to see that the amount of muck that is around, the kind of stagnant waters which are kept, the kind of potted plants that we have, all of them do contribute to the spread of the virus because we have a breeding site which is easily available for them. One of the other problems that we also see with dengue is that a past exposure to a dengue virus ever in your lifetime would predispose you to get a severe form of dengue the next time around that you get an infection, which is what we call in medical terminology as secondary dengue. So this is the mosquito, though it looks actually quite beautiful. It used to be called as a tiger mosquito because of the stripes that it has. It's something that is always a major concern for us. It's a daytime feeding vector. That means there is something called as a nighttime feeding vector. The nighttime feeding mosquito is that of malaria, whereas the daytime feeding mosquito is that of the dengue virus. There is obviously a mosquito to human transmission. So we also tend to transmit it to the mosquito. So the human to mosquito transmission is the reason why there is a perpetuation of the cycle. So if there is an Aedes aegypti mosquito in the household and you have already got infected with dengue, then 2 days before you start showing the symptoms of dengue, till about 2 days after you have cleared your symptoms, you are still likely to be carrying the virus within your system. And that is the time point where if there is another vector or another mosquito which comes and bites you, then you would be the one who probably would have infected the mosquito, and so the cycle perpetuates. There is also a limited number, but yes, there is also a chance that a mother who's pregnant and who's about to deliver could transmit that particular virus to the baby. So a child could have a congenital dengue infection because of mother to child transmission. These are the typical breeding sites that we see for Aedes mosquito. So you have rainwater, which are put in drums and pots, which is what we normally see in a lot of slum areas and in newer buildings, newer societies, and in construction sites. These are a common occurrence. Discarded containers under the shade. Even our own refrigerator, if you do have areas where there is an accumulation of water, that itself is a good enough site for the mosquito to start breeding. Rainwater inside the trap tires, indoor plants, and water pots, especially the ones where we keep our money plant and the ones where we keep our bamboo shoot, all those fancy feng shui kind of stuff that we keep in the household, they all can be breeding spots for the mosquito. Some water trays that we used to have in our old time refrigerators, and if there's a leakage, that itself can be one of the reasons. You can have your air cons, which could be also one of the breeding sites for your dengue mosquito. So once you have got the particular virus in your body, it takes a particular number of days for the virus to increase in number good enough to start having some symptoms. That could last anywhere between 2 days to 14 days from the time that you have got the virus in your body. Once you get an infection within your system, you need not develop a major symptom all the time. There are patients who have absolutely no symptom at all, barring some aches and pains. There may be some who may get some mild cold, cough, fever kind of a symptom, which we may disregard as a usual viral. Or there could be others who would have the typical characteristic symptoms of dengue, which could be pain behind the eye, what we call as retroorbital chest pain, which is when you tend to move your eyeball, that is the time point that it pains behind the eye. There are severe muscle aches and pains because the virus is known to enter the muscle sites as well. There will be tremendous amount of bone pain, joint pains. There could be rashes which would come up by about the 4th or the 5th day of your illness. Nausea and vomiting, basically because of liver involvement, as well as the disease itself, because of the high fever, could make you throw up. The patient significantly complain of severe headache. And of course, there would be a high-grade fever. By and large, the fever is pretty high and it doesn't really come down well with medicine. So you may still hover somewhere in the range of 100, 101, despite taking a paracetamol round the clock. The good part is most of these symptoms are pretty self-limiting, and in majority of the cases, dengue may not be really severe. So the chances of death in dengue with in severe form of dengue is just about 2%. So that means 98% of the patients do well. What are the warning symptoms? Now, as I said earlier, the individuals who have had dengue for the first time should be a little more cautious if they are aware of the fact that they've had it earlier, of the fact that you could have a severe form later on. So when you come in terms of severe dengue, what are the symptoms that you really have? It'll be severe abdominal pain, a lot of vomiting, which is persistent, difficulty in breathing. If there is any bleeding from any side, I've mentioned your nose and gums, but bleeding from any side, mind you, is important for us to understand and to pick up these cases. Fatigue, restlessness, if if you're extremely thirsty all the time, if there's a pale and cold skin, if there's a feeling of immense weakness, then these are the symptoms that you need to really pick up and come to the hospital with, or go to your primary care doctor so that you know that you're not going to land up with trouble. So between the mild and the severe dengue, as I said, we did speak about the mild symptoms, which is flu-like symptoms, nausea, vomiting, muscle pains, headaches, and pain behind the eye. In severe ones, you would have shock. Shock, when I say, it means your blood pressure is below the normal acceptable level. So for us, if you have a blood pressure of 120/80, then if your pressure is close to about 90/60, you know that you're landing up in trouble. If someone is on the lower side of normal, so if your blood pressure ranges in between somewhere like 90/60 any which ways, then if you even come down by another 10 points, that would be critical enough for us to put you into the hospital. If there's severe bleeding from any side, if the vomiting is persistent and it is severe, if you have a multi-organ dysfunction, that means besides your fever, you also develop a lung involvement, or you develop a kidney involvement. If you have brain involvement, which a dengue can cause, then these are called as multi-organ dysfunction. Severe abdominal pain, which is one of the heralding signs that you are going to land up in trouble, in the form of what we call as serositis. So in dengue, what typically happens is your blood vessels, they become like sea. So whatever amount of water you take in, it still goes into some spaces in the body, which we call as third spacing, and that causes the dehydration to still set in. So if once you have the fluid getting accumulated into your tummy, then you start having a lot of pain in the stomach. And that's one of the signs to say that your blood vessels are not able or capable enough to hold on to the fluid. If you have easy bruisability, which could happen when you have a lower level of platelets. So what are the things that we really can do to prevent dengue? This is for all of us. We need to cover our containers if we do have water shortage, and if we land up, keeping them or storing them. Use insecticides as and when there is a need in appropriate areas, including your potted plants. Breed small fishes. Now, these may not be very doable for majority of us, but then certain kind of fishes can probably help us in certain areas where there would be a small pond or a lake kind of a scenario. Throw away the extra whatever amount of water whenever possible. Do not keep it in that particular container. Don't kind of keep half glass of water or half a bottle of water just like that open. Clear the clogged drains. We have plenty of drains which are going to be in and around Oberoi, so we need to see that that stays clear all the time. Apply mosquito repellents. There are people who get bitten by mosquitoes far more than certain others. So it's important that we continue to use mosquito repellents if we are one of those. Wear long, bright clothing. Fortunately for us, keeping our hands and legs covered even at home front, because as I said, dengue is a daytime feeder. So most of the dengue mosquitoes, they probably are going to be within your household and within whichever area that you're working in. So if you continue to wear a long sleeve cloth, then there's a good chance that you may not get bitten by them. Set up mosquito traps or whatever else in the form of repellents that you could have. Use a baby cot, use a netting. You could also use a mosquito net for ourselves as well. Keep the windows closed as much as possible between at least 5 to 7 and in the early morning hours. That might help us. Lower the risk of getting bitten by the mosquito by covering yourself as much as possible. Use mosquito nets, use window screens, use mosquito repellents. This is something that I'm reiterating again. There are 2 vaccines which are available, but which are not available in India as of date. These are just been approved by the US FDA. One of them has been approved by the European nation as well, which is Dengue. Dengue is going to be subsequently approved. Now, that's something that has come out from Japan. Dengue is supposed to be given only to people between 9 to 16 years of age, so it's not meant for adults. Whereas Dengue is supposed to be right up to the adult age group. Dengue, the biggest problem with that vaccine is you cannot take it if you have not had dengue in the past. So for each of the patients who would be wherein dengue could be used, you have to actually prove with some blood test to see whether they have already got dengue in the past and then take this particular vaccine. Whereas with dengue, you could give it even if you have not had it ever in the past. And the age group, like for dengue vaccine, I said it's 9 to 16. This is anything between 4 years plus. Dengue seems to be a promising vaccine. The efficacy for that is about 60%. That means it reduces the risk of getting a dengue infection by 60%. The mortality reduction is quite substantial though. With dengue vaccine, the risk of reinfection is supposed to be, prevention of infection is supposed to be about 80 odd percent, which is fairly good. So both the vaccines are decent. We have 3 more vaccines which are coming out from our country. We are expected to get some vaccine on our shows not before the early part of 2026. That's another 2.5 years away from us. So what happens if you get dengue? The first and the foremost is even if you do not feel all that sick, do remember that it's a virus which can get better of you. So take rest, drink plenty of fluids. The main crux of treatment of dengue is fluids. We focus on platelets unnecessarily. Platelets are important. We are not denying that. But what is most important is the amount of fluids that you take. So when we are dealing with an adult, we say upwards of 4 liters is what you need to take in. If you feel that you're unable to take about 4.5 liters of water in a day, then you probably might require an IV fluid. Other than that, you would be able to manage yourself well in the household as well. Use only paracetamol for pain and fever. We do understand that paracetamol probably is not good enough to handle the high-grade fevers that dengue could cause or the kind of pains that you would have. But that's, remember, the safest option that we really have. Avoid using an NSAID, what drugs like Brufen, aspirin, easily over-the-counter available drugs which you could take, nimesulide. All of these can have potential complications in dengue. So they have to be avoided like plague. Be watchful for severe symptoms. So keep a track of your symptoms, to keep a track of how thirsty you feel, what are your, the basic ones, the warning signs that I spoke about. Contact with your family physician if you develop any of these signs which we spoke about earlier. So what's the take home? There is no specific antiviral. So to be honest with you, there is no medicine required other than paracetamol for dengue. Maybe you can take some multivitamin preparations, but all that you need to do is to take good hydration and paracetamol. That's the key treatment. Platelet counts are bound to drop in dengue. They will drop till 7 days of the symptom. So there's no point getting psyched about looking at your platelet counts. Yes, you need to be hospitalized if your platelet counts are hovering in that 75,000 zone. But you don't need to do anything else other than that for that particular period of time. No amount of eating a certain kind of fruit, drinking a certain kind of juice would probably increase the platelet count. That's a popular notion, is being done across the city. There are a lot of pills which have also come out in the market. Believe me, there are no control studies which prove that they work. In fact, in all probabilities, they are just placebos. Giving platelet transfusion, a lot of patients come proactively and say platelet chada do. That's the last option for us. That's not the first choice. So we give that only if there is a real indication to give a platelet transfusion. And for us, that indication is whatever is your platelet count, but if you bleed, then we give you, or else we wait it out till your platelet counts are less than 10,000. Only a few patients. So if I look at 100 patients who walk into the OPD, only about 5 to 10% would actually need admission. So the bottom line is, do not panic. Majority will get better without an active intervention. But you should be in touch with your family doctor, whoever is the person who has been taking care of you, so that you can report back to them in case there is an emergency. Thank you so much. I hope this talk was helpful. Happy to take any questions if there are any.
It was really indeed a good one, Anita ji, and I think slide after slide, it was at least a very new knowledge for me. But over to you, Dr. Sanjana.
Yeah, thank you so much, ma'am. It was such an informative session. But I do have some questions that we had gathered over a period of last week.
Sure.
So first thing that you said, that no natural remedy could help. So that means the papaya leaves or the papaya remedy that most of the people take, making a papaya juice or taking the papaya leaf and making a juice out of it, that won't be really helpful during a dengue fever.
It certainly is not helpful, other than probably causing loose motions.
Okay. One more thing, ma'am. Can you tell me the stages of dengue? What are they, and when should one see a doctor? At which stage?
So, to be honest with you, there's nothing like a staging of a dengue, right?
Okay.
So when we talk about dengue, you start off with a fever and the fever will continue for 5 days, irrespective of what you do. your platelets are going to drop every single day from day 1 to day 7. This, what I'm talking about, is generally what would happen in maybe about 95% of population. There are 5% which are going to be outliers. So they may not fit into that particular thing. But by and large, you will see a drop in platelets. But at any time point, if you're unable to drink enough water, when I'm saying drink enough water, in an adult individual, I would be wanting upwards of 4 liters. So if you're unable to take that, if you're unable to retain anything, if you're vomiting out all the time, if there is an abdominal pain which comes up, when I'm talking in terms of abdominal pain, it's an upper abdominal pain, close to where your liver is, which is on the right side upper abdomen. Those are the time points that you would be worried. But there is nothing like a mild, moderate, severe when you're talking in terms of you're talking in terms about the symptomatology, which is what I showed earlier. By the time you're into a severe dengue category, it sometimes is difficult to get the patients out.
Correct. One more question I have. So chikungunya is also equally widespread as dengue, and a lot of times even the doctors would get confused between whether it's a case of chikungunya or is a case of dengue. What can be done as a member or as a person? How can I differentiate between the two, and how can we help it in the early stage of dengue or chikungunya?
So both of them are diagnoses which are based in terms of labs. So the way to differentiate between chikungunya and dengue would be very difficult in the initial scenario, because they will both behave similarly, because they belong to the same family of virus as well. So what you typically would look at is chikungunya causes lot more arthritis. That means lot more joint pains as compared to dengue. Dengue, the patient will say, I have pains all over. I have a severe backache. I have severe muscle pain. Right? Whereas in chikungunya, they will predominantly tell you that the pains are all in the joints. It's less of muscle and more of joints. So that's one way to differentiate. Both of them will typically cause rashes. Maybe the drop in the platelets in chikungunya may not be as bad as that you would see with a dengue. And as I said, what clinches the diagnosis is your labs.
Correct. One more thing, ma'am. You spoke about secondary dengue, or in a layman's term, severe dengue. Most of the people know it like that. How can one protect itself other than the Odomos or the cream gels that you spoke about, or the other cleanliness habits? What can I do as an individual to protect myself from a secondary dengue fever? Or how do I know in an early stage that I have got secondary dengue, and when do I go to the hospital and get myself admitted?
Right. So if you've had dengue in the past and you get dengue again, then you know it's a secondary dengue, because you would know that you've had it in the past.
Correct.
There are a lot of patients who come and tell us that they've never had dengue, but if you do the blood test, then you do tend to figure out that they've had dengue in the past. As I said, as a child, you may have had cold, cough, fever, and that could have been a dengue. Sometimes you have no symptoms and it still is a dengue, right? So there is no one way to differentiate whether it's a primary or a secondary, unless and until you see the drop of the platelets being much more than what you would normally expect. Say from every day, if I expect the platelet to drop in a particular individual by, say, for example, 10,000, because that's a pattern that he's been following. If he starts dropping by 20, 30,000, then you know that there's something amiss. There's something which is there in the background, which is causing more destruction, right? So there you could probably have some idea that it's a secondary dengue. How can you prevent it? The only prevention is by preventing mosquito bites. There's nothing that we can really do there.
Okay.
Here, all that we can do is to see to it that you have as much of protective wear that you probably can put on your body, and then maybe pray to the Almighty that you stay safe.
Okay. One more thing that people were very curious about was lot of them have a fear that, you know, if I get secondary dengue, it's the
It's not
end.
life-threatening. It's not. See, most of the time you would be in a position to come out of it. As I said, it's only 2% population who are known to succumb to the infection. So we don't need to get alarmed.
Okay.
So my 2 bits is don't panic if you get dengue.
Okay. I would request all the members to send in their questions if there are any, so I can look into it and direct them to doctor.
I
Yeah,
think
and
Bhavna ji has one
yeah,
question. She'll
exactly.
raise her hand.
Hi, can I
Now-
ask my question?
Yeah. Yes, please go ahead.
Okay. Thank you, ma'am, for very insightful talk and knowledge shared with us. I have a question here. Dengue viruses, there are 4 types.
Right.
So does the severity depends on the type of the infection, and
Yeah.
how does the treatment vary?
The treatment doesn't vary at all. That's the good part. Of course, in terms of the virus, there are 4 different strains which are there. That's Den 1 to Den 4. But we do not really look at the strains. These are more for research purposes. These are not done on a regular basis. So your normal labs are not competent enough, and they do not have the means and the wherewithals to look at which strain are we looking at. These are for academic purposes and research purposes. So there are samples which are picked up every season, and those are sent to NIV Pune. And that's where we look at what strain did we have in this particular season, right? In terms of severity, Den 2 is supposed to be severe, Den 3 is supposed to be severe. But most of these, you would get to know only if you look at the research lab. Otherwise, you will not probably know it any which ways. Since the treatment doesn't change, since the line of management doesn't change, we don't really need to do anything here.
Right.
Thank you,
One
ma'am.
question I have for you, doctor. One, when do I go for lab testing? Is it on my second day of having high fever, or is it on the third day or the fifth day? When do I go for a lab testing?
So my 2 bits is, if you do not have any other symptoms other than high-grade fever, headache, and body ache, then at least wait for the next 24 hours and then get your first test done. We know that the fever would last for a period of about 5 days. We also know that there is some amount of liver involvement which occurs by the 4th, 5th day. So the next test should be done ideally around the 4th, 5th day onwards. So then from then on, that's when the platelets really starts dropping. So from then, I think your doctor themselves will tell you, depending upon the number of platelets that you have on day 4 or day 5, whether a daily test is required or a staggered, once in every 2 days testing would be required on you.
One of our member is asking, does this mosquito breed only on clean, stagnant water?
Yes. It doesn't breed in dirty water like your malaria mosquito is known to do.
Okay. Anyone has any question apart from this?
Yeah, ma'am. I have one question. It's a little academic
Sure.
question, ma'am. This dengue is prevalent only in India and Asian countries, or it is prevalent all over the world?
It's also there in Brazil, all tropics and subtropics. Any area, Puerto Rico, all these areas also have dengue. In
So
fact, that's the
tropical
reason
climate,
yes,
yeah, tropical climate breeds. Correct.
tropics and subtropics. That's the reason the vaccines are available in US. Otherwise, US doesn't need those vaccines. But they have Hawaii, they have Puerto Rico, where you would probably be needing it because it's a subtropical climate.
Sure. Thanks, ma'am.
You're welcome.
Okay,
Yeah.
sorry, can I ask question,
Sure,
Sanjana ji?
sir.
Yeah,
Okay, so Dr. Anita, I have one question, very basic question. I think the premise which is in front of our building is, I think, HDL, and that thing is not going to get resolved very soon. That water logging will still remain. So are we going to be in this fear for next 4-5 years, or because we can take up precautions, but what if that water logging keeps on happening?
Unfortunately for us, we have been living in that fear for the past 30 years plus. Dengue has been prevalent in our city. And I think the worst that we saw in terms of dengue was in the year 1999. That's the year that we really battled a lot of dengue patients.
Okay.
I was working. So I don't see any respite from this. The problem is a pan-Indian problem of urbanization. I'm not saying that urbanization isn't good, but the way that it has been happening is something that is a problem. So if it's not just HDIL, it's just all around us. The way that things are disposed, the way the water, gets stagnated into a particular small little pothole, all of these are going to be problem areas for us. So I don't think we are getting away from it. So the only way that we can do is to try and do whatever bit we can from our end, keeping our premises clean, seeing to it that whatever is there, at least near to our area, we will have to proactively go to the BMC office and probably eat their heads, telling them that, we need to do something here.
Correct. So at least making our premise clean and having that close coordination with housekeeping is, I think, one
Yes.
best thing we can do, and
Yes.
then keeping our eyes open for the surrounding. Okay,
Sure.
thank you.
One more question. Is there any specific pre-health condition which people may have are more prone to severe dengue? One of our
So,
list
so
of
all our
diseases.
comorbidities that we're talking in terms of, so if you have a diabetic, you're a person who's immunocompromised. When I say immunocompromised, it's people with kidney disease, liver disease, people who are on steroids for whatever as an immunosuppressant, people who have post-transplant, people who have cancer. These are the patients who will obviously not have an immune system which is geared up to fight an illness. Even if you're a very well-controlled diabetic, your immune system is lacking certain things that you would normally need to have in a person of your same age, same sex, everything same, but who's a non-diabetic. So that non-diabetic will have a better immune system than yours to be able to tackle it. So obviously the comorbidities will make you a little more prone for a worse infection, but that necessarily doesn't mean that dengue in this population should lead to certain, downfall. That's not something that's addictive.
Ma'am, you spoke about using chemical repellents or mosquito repellents. So there are two kinds that's available in the market. One are the chemical ones, one are the natural based ones. Which one is better and what should we use?
So if you look, I'm talking about randomized control studies because that's what our medicine actually propagates. So if you look at RCTs, your DEET, which is your chemical based ones that actually show a good amount of efficacy. There are ones which are available in the market, which is from citronella oil and stuff like that, which also do work. So it isn't as if you need to apply all your, pesticide, insecticides on your body, but those chemical based ones can be put into areas where you have a lot of breeding ground. And for within your household, you could be using the ones which are plant based or herb based, which is what my take would be.
Okay, so ma'am, there is I'll talk to you about a kid. Okay, so if suppose I'm a mother, so what do I apply? Do I apply Odomos or do I apply Mama Earth's gel that comes in? Which one
If
is
you ask me, I'm also a mother. I mean, of course, my kids have grown up, but
I'm not a mother yet.
but then having said that, I use Odomos as and when there is a need.
Okay, got it.
Yeah, hi ma'am. I have a question. You mentioned during your presentation, there are two vaccines which are available, one for kids and second for all population. And as far as Indian vaccine manufacturers are concerned, they are doing clinical trials, which will take another 2 to 3 years time to
Right.
come to the market. So my
Right.
question is, for those two vaccines which are available, are those vaccines available in India?
No, they are
If
not
no,
available in India.
okay, and is the DCGI or government is doing any effort that to bring those because they definitely have done some clinical trials on the large population. So are there any efforts going on from government of India to bring those medicines? So
I'm not certain about it because as of now we are not seeing anything coming into our country, even from Takeda or Sanofi. These are the two companies which have been looking at marketing these particular vaccines coming into our shows. Takeda has just been able to give it off to European Union very recently. So even if you're looking at something, it's not till the later half of 2024-25. It doesn't happen so soon. So in India, we ask for trials to be done again in our population.
yeah, I understand.
That makes it more difficult.
No, I agree because I'm from the same clinical research background. So yeah, so it's really though many whether it is serum or Bharat vaccines and all, they are trying their best. But yeah, as you are correctly mentioned, it will take a couple of years to bring.
It will take a couple of years. Our DCGI doesn't give approval so soon for whatever reasons. I mean, I would rather not go into the nitty-gritty.
Yeah, understand. Thank you, ma'am.
Welcome.
One more question. Any specific care to be taken for senior citizens at home having diabetes?
In regards to dengue?
In regards to dengue?
No, I don't think so. You need to do what you're doing to do from what we call as neonatology to geriatrics. That is from 0 age to whatever age limit that you have. The precautions stay the same. They stand the same.
Okay. So great. I don't think so there are any other questions that's popping off at the moment.
Ma'am, one question I had is you mentioned that once a person is infected, home remedy is definitely not a good strategy. But is there any food that one should avoid eating
No,
or
there
one
is
should
none.
eat?
You can eat whatever you normally eat.
Okay.
You just have to keep up your let me be honest, most of the patients can't even eat after drinking 4 liters of water. Right? So we encourage them to eat whatever bit they want to. So it doesn't matter if you're a vegetarian, non-vegetarian, whatever you want to eat, eat, because that's going to
What,
sustain you.
yeah, whatever can make them happy,
Yes.
in this
Yeah.
gloomy situation. Yeah, cool.
Okay. I think Sriram has summarized it nicely because indeed it was a good knowledge session. Considering it is the first one, it became as a very relevant, very focused, and I think questions will keep on popping up. But maybe a last call. If anybody has any question, let us know. Otherwise, we'll kind of go for a final poll then.
Can I ask one question?
Yeah, please. We have another 20 minutes max. So if anybody has any
My-
question, please go ahead.
My simple question is that a smoke, spraying everywhere with the smoke, whether this is helpful for this dengue, or always people I see going around over our buildings with the smoke. Does it help?
What you're trying to say is fogging?
Fogging?
Yes.
Yeah. So fogging does have some amount of helpful utility to it. I wouldn't say that it is of zero utility, but the way that they move around is probably not as great. You need to look at and concentrate it into areas where you know is the breeding site. So like we have a lot of plants and pots in our complex, right? So you would probably have to
Yeah.
look at where is the reservoir there. And there has to be frequently somebody visiting that area to see if there is a breeder. And probably go ahead and target it there. Just simply fogging probably will reduce the numbers, but not to the level that you would want it to.
Yeah. Yeah, because particularly near the Eternia building and Oberoi Enigma as well, there are so many laurias and mosquitoes coming up, and people are considerably telling, like Mr. Jagdish and all, that these are the area where it has to be taken care. And that is where I've never been there. That's why I don't know, but I was just asking whether fogging helps or not.
So it does help, but not in the way that people think that it does. So just moving around with a fogging machine probably is not going to be good enough.
Yeah.
Thank you so much, Dr. Anita. It
Thank
was
you,
really very helpful. Like even knowing so much, this brushes up our knowledge and it makes us more aware of the situation. So we are not just sitting at home and using papaya leaves anymore and going to the doctor, getting the help that we need.
Thank you. Thank you.
Thank you so much.
Yeah, okay. So thanks, Dr. Anita ji. Thanks, Dr. Sanjana ji. And first of all, many thanks to the members. I think they have been coming with a lot of questions, and that made it really a good interactive sessions. I think we just kept our doors open, and the fact that Anita ji said few things I was just comparing when I'm going to move there is, I think, first of all, it is not life threatening. It can be cured. Only 2% of people get to hospitalization, and you can't kind of avoid it. It may happen. So I think we can certainly move. We don't have to overthink over it, but obviously we have to be very cautious. And last but not the least thing is we have to keep our premises clean about it. I think so. That's
One
a
more
good.
thing I would like to add, a lot
Yeah.
of people are scared to go to a doctor, whether it's an infection or dengue or anything like that. Let's not be scared of these things, because at early stage, all of this thing is curable. But when you delay it, probably it gets more severe and out of the hand, then even doctor can't help you with the advices that they have. So visit a doctor at the early stage.
Yeah, indeed,
Correct me if
true.
I'm wrong, Dr. Anita.
Hello.
Hello.
Hello. Yeah.
Yeah. So I just said that people should go and visit the doctors and they should not be scared of them, because a lot of them would be scared that no. So I'm saying that they
So-
should go at the early stages and not at the severe stage.
Yeah. So the whole point is, as I said, you just need to go to your family physician.
Yeah,
They,
correct.
they are your first point of contact. So
Correct.
you don't need to really rush to a hospital as such, but be in touch with a family physician. As I said, you would have 90% of patients getting better at home front itself with their help. So utilize that.
Yeah.
Yeah.
You don't need to really rush to the hospital to meet a specialist for the same.
Sure. Okay, Abhishek, you have anything, because he was helping us in consolidating few of the inputs.
No, I have asked my quota of questions. Ma'am, thank you so much for answering all the questions very clearly. And yes, we
Oh,
stand really more informed than what we were earlier. Thank you so
Thank
much,
you,
ma'am.
Mr. Iqbal.
I think
Thank you.
Miss
okay.
Anita has one question.
Yeah,
How,
there's a question put up there. We can take that. Yeah.
yeah, how about swimming pool water? Does that cause a threat for dengue?
Generally speaking, it shouldn't be, because though it's a stagnant water, I'm sure it gets circulated as well. So that actually reduces your risk of having an infection sitting there. It's a stagnant, clean water that is a concern. The swimming pool water, though it is stagnant for a certain bit, once you start moving in that, there is a recirculation mechanism to it as well. So
Okay.
that reduces your risk of having a breeding site there. But technically, yes, if it just stays like that for a couple of days, yes, it could be a breeding site as well.
So that means we should use our swimming pool more
Yes, you
regularly.
should use a
Yeah,
swimming pool
it's in
more
our benefit.
frequently.
Yeah.
Okay, good. Fine. So let me launch the closing poll. Certainly, if anybody has any question, they can ask. But let me do this.
There is one last question which has come.
Yeah.
How
Yeah.
far kiwi and dragon fruit help in shooting up the platelets? I think you have answered that now.
Yeah,
Yeah.
but let me reiterate that if you want to eat kiwi as a fruit and dragon fruit as a fruit, please go ahead and do it. It has no harm. But with the intent that it is going to improve your platelets, probably it is not going to do that. But it's a fruit. Ultimately, at the end of the day, it gives you protein. It gives you nutrients. It gives you minerals. It gives you certain amount of vitamins. So go ahead and have it. There is no harm in having it.
Okay. So I think the poll is going on. While the another question which is coming in my mind, Anita ji, is since there is a lot of construction which is happening in our patch only, if you take Alpataru and others, I think this problem will remain for a long time, isn't it? At least for next 10 years, considering every building will come up with its own speed.
Right. It will stay with us. That's what I said. It hasn't changed in the last so many years.
Okay.
I don't see it changing in the next couple of years either. So unless and until we have some vaccines on our shore, which we should have pretty much soon. So we have waited for 8 years for Robiroy, so we can wait for 3 more years for the dengue vaccine or whichever vaccine that we get from our
Vaccine, we get it
yes,
from there.
from
Okay.
we'll get it from Serum Institute. That's the first vaccine which will come up. I think we should be good once we have that. At
And
least
the
it
fact
happens.
that yeah, and the fact that unfortunately we have so much of infection within our own country, I think getting our own vaccination is always helpful. I mean, it is more compatible to our bodies, and even for a general public also to consume. I mean, it's not will be super expensive.
Yes.
That's more important. Okay, good. So 14 people have already responded. I think overall, I see that all of them are saying that they can implement the suggestions right away. So I can see that many of the habits are going to get changed or going to get refined to what Dr. Anita ji and the group has been discussed. Second was the learning level. Five of them said that it was all new learning. One of is me. Then second thing is I knew some
I
of this and it was
should
sorry.
one thing I should tell, I should compliment doctor that he gave a very nice positive vibes.
Sorry, your voice is not clear. Can you repeat?
Ganeshji, can you hear me?
We can hear you, but not very clearly.
Hello, can you hear me?
But its voice is very fickle, Hitesh.
What you could do is you
Can,
could write
You can
can you
chat.
hear me
Maybe you
now?
can. Yes, now we can hear you. Yeah, go ahead.
No, it's not working.
Okay, I think Hitesh will come back, but I've just
Let me
published.
let me try again. Now is it okay? Audible?
Yeah,
Yeah,
yeah.
yeah.
This is good now. I hope Hitesh is not on a very high floor of Eternity or Enigma where network is a problem. So, okay, coming back to our poll, I think five of them found it new learning. I think many of them already had some knowledge about it. It was a good addition. There is one expert who already says, I knew it all. I will love to know this person. But it is good that some of them are really very knowledgeable. Talking about technology, most of them found it was a good, both audio and video quality was good. As I said, it is the first time we were also doing. So we were also curious to find how it goes. For example, right, only 1920, but let's say when next time we have a session, what if 50 or 60 join? So I think it is good, whatever the initial they find. Some of them found video quality was less, and I'm kind of worried about those two who said that both of them was not good. So will those who have a problem, you certainly get in touch with us, or at least me. I will try to understand whether there was an issue at your end or something that we can improve. But I think that is how the overall session has been. It's been really very knowledgeable, very easy to go. So for example, it was not if I have to say, not too much of a corporation, not too much of a medical seminar. It happened a very easygoing discussion, and I think that sets the tone for the subsequent health sessions that we will also be having. So if there is no other discussion point, I think let's close this call. Again, thanks Dr. Anita ji, Sanjana ji, and all members for joining this session. And as I said, we are already planning few other initiatives. I think one of the important initiatives, like the way dengue cure and prevention we're talking, we're also talking about plastic segregation and then kind of a collection, because that is also pollution. And when there is a pollution, obviously there is also health issues, and also there has been impact to our mother health. So let us contribute. It is going to be a pain. It's like going to a gym and making your body. Nothing comes for a free. So I think all of us want to do a plastic segregation, but it's very important to take pain doing it. But that's on the other front. I think we'll come up with more interesting topics on health front. If any of our members want to come in front and kind of have a session the way Dr. Anita ji had, or if someone wants to pick up another topic wherein we as a group want to work, do let us know and we'll try to plan them out. We are trying to have such sessions at least once in a month or two, so that it becomes a quite repeatable affair for us. So that's it from my side. Again, thanks everyone. Take care, and we will soon meet, I think, somewhere in our lobby.
Thank you so
Thank
much.
you.
Thank you,
Thank you
Mr.
so
Vinay.
much.
Take care.
Thank you,
Bye.
Mr. Yadav, and thanks a ton, Dr. Sanjana, for being a
Thank
moderator.
you.
Yeah,
Thank you.
thank you.
Okay. Thank
Thank you.
you.
Bye.
Bye.
Bye.